Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Limitations and indications of in vitro fertilization. Limitations of in vitro fertilization include severe oligospermia, obstructive azoospermia, and asthenospermia. Indications of in vitro fertilization in males: if there is oligospermia of around 5 to 15 million sperms per ml, or if there is repeated intrauterine insemination failure, then we can undergo in vitro fertilization. In females, if there is blockade of the tube or if there is decreased ovarian reserve, then we do in vitro fertilization with the donor eggs. In Mullerian agenesis, we can do in vitro fertilization along with surrogacy. Surrogacy can be tried in Mullerian agenesis. In males, main indication is oligospermia with almost 5 to 15 million sperms per ml.
thank you and thank you for watching.